talking about flat foot, which is pes planus for medical students. So a flat foot depends on your medial arch. So as you can see, here are the bones of the foot, and your medial arch is what determines whether your foot will be flat or highly arched. If it's highly arched, it's going to be called carvus, and if it's flat, it's going to be called pes planus. Flat feet, also referred as flat foot, pes planus, is also known as a fallen arch, and this is a deformity that can occur quite frequently in children. And sometimes it's often asymptomatic because sometimes it's a flexible rigidity, and sometimes it's a rigid deformity. Sometimes it's a flexible deformity, and sometimes it's a rigid deformity. So this can be due to flattening of the longitudinal arch of the foot. So we have multiple arches within our foot, and these arches help to keep this height to the arch of the feet. And if there's a disturbance in this arch, that is what leads to a flattened foot. The arches of the foot can be three. So there's a transverse arch, which can be seen here, going from A to B. Then from B to C would be on your medial side, actually here on your big toe side. This is the medial arch, or the medial longitudinal arch. Because these are going across the length of our foot, this would be referred to as a longitudinal arch, as with this one. This is the medial longitudinal arch, and this is the lateral longitudinal arch, and here is the transverse. You can get two types of deformities when it comes to orthopedic abnormalities of the feet. You can get a flexible deformity or a rigid deformity. How do you determine whether or not this flat foot is a flexible or a rigid deformity? Essentially, when a patient is standing up, you can notice that their arch disappears, that the medial arch that we talked about earlier on the toe side disappears, and that causes the foot to be so flattened. But if the arch is present when the patient is sitting or leaning their legs off the bed, if you can observe that the medial longitudinal arch is there, but it only gets disappeared when the foot is flattened or when standing, that would be a flexible deformity. Start say flexible. This should say flexible because it's flexible. It's there. The medial arch is there when the patient is sitting down or hanging the legs, but the medial arch comes and goes, and that is what makes it a flexible deformity. Flexible flat feet. So this just proves my point before. So during a standing position, when the child is weight bearing, you can observe a normal arch which does disappear. A normal arch would disappear and it will appear flattened. But as soon as the patient lifts their foot off of the ground and tiptoes, the normal arch actually reappears, and that is what determines the fact that this is flexible deformity. Just to remind you, when you talk about deformities of the feet, you have dorsiflexion and plantar flexion. Dorsiflexion is when the foot is dorsally flexed towards the tibia, towards the body. Plantar flexion is when the foot is flexed away from the body, and it's like you're planting. Plantar flexion, you can remember planting the foot on the ground. Often, this flattened foot and the club foot can present due to abnormalities of the Achilles tendon. So when it comes to observing the Achilles tendon, often if it constricts, if the Achilles tendon is constricting over here, that would cause an equinus deformity. An equinus deformity is when the foot is in plantar flexion and the heel is off the ground. But interestingly enough, this Achilles, to check for a constricted Achilles tendon, you have the SILVERSKIOLD test. This test is very important, and essentially, whenever you're checking for a shortened Achilles tendon, which is causing these deformities in the foot to appear, you can check for dorsiflexion, So is there dorsiflexion on the normal foot? Is there dorsiflexion at the level of the ankle? And is there dorsiflexion at the level of the knee? That is what the basis of this test is. So how much can you dorsiflex the foot at the level of the ankle? Okay, if you can dorsiflex it, for example, 30 degrees dorsiflexion. But once your knee, once you do dorsiflexion at the level of the knee, now if dorsiflexion is improved, if dorsiflexion was reduced at this level at the ankle, but now at the knee, you can observe that you can dorsiflex the foot even more. If there's a greater degree of dorsiflexion here, that means that the Achilles tendon was indeed shortened. So initially, at the level of the ankle, if there's some dorsiflexion, limited dorsiflexion, but then once your knee is extended like this, and there is a greater degree of dorsiflexion, that means the Achilles tendon was constricted. But if dorsiflexion remains reduced, it's reduced at the ankle and it's also reduced at this level of the knee extension. If its dorsiflexion is still reduced, if it doesn't increase, that means that the whole ciliary muscles were constricted. What is the SILVERSKIOLD test? So this is what I've just described. It measures the dorsiflexion of the foot at the ankle joint with the knee extended and flexed to 90 degrees. This test is considered positive when dorsiflexion at the ankle joint is greater with the knee flexed than extended. Here's flexion, here's extension. Actually, this test is positive. This test is performed when the patient is seated supine. Again, a flattened foot is due to a fallen arch. Here would be a normal arch. Normally, in children, you can see a normal arch, and in adults, you can see this normal arch as well. One of the main causes of flattened foot is hypermobility, but one of the conditions, cerebral palsy, is the condition where you would see a flattened foot. Just to remind you, what's a pes valgus? Well, for valgus, I remember L for lateral. So this is when the heel of the foot is pointed laterally. So the heel is pointed outward or laterally, and it's easier to observe pes valgus when you can compare the heel of the foot to the tibia itself and to the lower leg. If the heel of the foot is pointed outwards, that is pes valgus. Often in pes valgus, you can see pronation of the foot over here, as well as the too many toes sign. Normally, in healthy adults, you should be able to see only one toe. Here you can see too many toes. That is characteristic of pes valgus. And another reminder for talipes equinis, you have a plantar flexion of the foot. Remember, feet planted on the ground. Often, talipes equinis occurs due to a contraction of the Achilles tendon over here. And equinus reminds me of equestrian or horse related. So if you want to remember what equinus looks like, just imagine a horse on its hind legs. The same way, it's kind of like on its tiptoes. Cerebral palsy is a condition I talked about earlier, in which you can often see this flattened foot. And this is a group of motor conditions that causes physical disability in development, and cerebral refers to the cerebrum, which is damaged in the brain, and palsy refers to the palsy of movement. And as a final X-ray image, we can observe the tibia here, the fibula here, the talus here, the calcaneus, navicular, cuneiforms, cuboid, and the metatarsals and the phalanges.